Of support for Liberia is coming from right here in Rochester. Time Warner Cable News reporter Tara Grimes spoke to a local professor who visited the country earlier this year and tells us the heartbreaking lesson he learned.
They're a very fun group to hang out with.
For RIT Assistant Professor John Oliphant, the Ebola epidemic in Liberia hits close to home.
It's not just some anonymous group of poor West Africans, it's a bunch of my friends and colleagues.
In January, just 2 months before the outbreak, he made his second trip to the country, becoming a licensed physician there and visiting health clinics. What he saw was concerning.
So you just use these tools and then the next patient comes in and you use the tools again?
They only had one pair of rubber gloves that the staff had to share amongst themselves. They had no running water, they had no electricity to sterilize instruments with an autoclave or even different kind of chemical disinfectants.
And while Oliphant says Ebola is easily preventable, those flaws in the system make it hard to contain the disease.
The last I knew, about 170 healthcare workers had died from Ebola, so I know that included physicians, physician assistants, nurses, even a hospital administrator that I really enjoyed spending time with the last time I was there.
But now, with the help of several local organizations, Oliphant hopes to be a part of the solution.
Interval has a lot of medical equipment that they're able to package. Friends with Friends Against Ebola is getting other equipment donated. Our World Outreach is kind of coordinating the financing and shipping with Earthsource Minerals to get all of that over there.
Among the supplies, doctors will receive 4 large pallets filled with personal protective equipment, linens, and other tools. They're even helping to ship an ambulance coming from another part of the U.S.
The plan is to utilize the physician assistants and other contacts that John has to ensure that it gets to where it's needed the most.
And although Oliphant shares a personal connection with those in Liberia, he says this is an epidemic everyone should consider helping to prevent spread.
The CDC has estimated that if there isn't a worldwide, significant intervention, then the exponential growth of the number of cases is terrifying.
Even more cases Oliphant couldn't bear watching his friends suffer through. In Rochester, Tara Grimes, Time Warner Cable News.
There's a